Hello, everybody. First of all, I want to thank this invitation, Tom Jude, and the entire organization team of the Clinical Engineer Division. Many technologies that we used during last 14 months to combat pandemic caused by COVID-19 are technologies that everybody knows. Perhaps many innovations has been the way in which we immediately incorporate them into organizations and health institutions. In Mexico, first project of telehealth were made almost 20 years ago. The first national telemedicine program was developed around 2008. And since that year, we have worked together with institutions on the national health system for the incorporation in public and private medical units. From the National Center where I work, we integrate and develop information related to telemedicine and telehealth for decision making. We support and advise the implementation, operation of projects and programs, as well as supporting the training and development of skills in health workers. In the past years, like 23 of 32 states that integrate the Mexican Republic had telehealth programs, and they attend about 120,000 remote consultation and similar number of activities of telehealth every single year. As happened in all countries, the pandemic forced the use of available resources to get information efficiently to health professionals and citizens. A lot of web portals and mobile applications were created for prevention of disease, dissemination of good practice, and habits in order to contain the spread of the virus, as well as tools for diagnosis, treatment, and monitoring of the sickness. Digital georeferencing tools, real-time information platforms, access to information, mobility, and location of care units. We promote the use of digital technologies to avoid attending health center and hospital that will motivate concentration of people. Public and private hospitals show a teleconsultation increase and telehealth action increase. In addition to the well-known remote medical consultation, other types of activities were attended, such as medical advice, consultation between professionals, remote diagnostic interpretation, follow-up consultations, and extensive use of technology for educational and training sessions. Just last year, we made about 6 million telehealth activities to care for COVID-19 patients and continuing care for patients with other diseases. More than 400,000 health professionals were trained in this year through digital information systems. In addition to the use of specialized platforms and software for telemedicine, several collaborative platforms were used in order to exchange information between health professionals and also health professionals with patients. Collaboration platforms are not designed for a secure exchange of information for healthcare purposes. But on the other hand, these platforms are very easy to use. Patients have easy access. The patient feels so comfortable using their own devices and those so friendly systems. COVID situation creates possibility to access medical information and to access doctor and specialists. But the price you have to pay is to face a greater risk in information security. So, it is necessary a greater participation of the engineers to find a middle mean between development and specialized system for telemedicine that have complete security and regulatory criteria, but systems that are easy to access so patients feel comfortable when using them. Returning to the topic, of remote care during pandemic, this is the general process. First, the patient passing a kind of filter. Sometimes it is not necessary attend in the first approach by a doctor. It could even be attended by a cognitive assistant. And depending on the request, the technical via could be a phone call, video conference call, or simply continue talking through two-way text messages. If the problem is not solved, the intervention of a doctor is requested to provide medical advice at a distance. Depending on the case, the patient can be followed up virtually, or the patient can be referred to a medical unit to be treated in person. In either case, a good percentage of attentions were solved remotely. Many of them do not require the intervention of a doctor. The pandemic forced us to find immediate solutions. Some institutions were prepared to fight this problem, but some others found themselves at times with limited infrastructure and limited human resources, either due to the number of medical staff or limited digital skills. Many health professionals, even without having all the technological tools to develop remote health service, found ways to transmit health information. Perhaps not in the best way, but in an effective way. In the picture in the left side, we can see two doctors in Latin American country doing acquisition of radiological images in a rudimentary and basic way, but effective way. Again, like we said before, it forced us to engineers to continue looking for more accessible, simple, but totally safe solutions to meet the needs of medical personnel and patients. Telehealth is today a topic that is on the institutional agenda of many health organizations. There is a high demand for knowledge and skill in digital health. After a year, we find safe technologies with better access. Collaboration between professional institutions has become more robust, and thanks to the digital technologies, much more common. After 1 year, a large percentage of health professionals have some experience on telemedicine, and that helped to break down barriers of resistance to change and achieves a better acceptance of the discipline. Thanks for your attention. My name is Adrian Pacheco.